Yeah.
Right.
Hey, we're on with Mike and Susie with the Pima County Employee Retirees Association, and they're talking about how they were basically pulled off very abruptly off of the county's plan, and they're now paying 5 times more than they probably should for their health care, and feel like they've basically been kind of betrayed by the county on what the previous deal was.
Absolutely.
What was the timing of when they told you they were going to do this to the time they what was that time frame?
I received the letter late February, and as of July 1, we had no coverage under the county. And they didn't do anything to help us find other insurance. They just said state insurance is available to you, which, like Mike said, has ended up being 5 times the cost. What I'd like to point out here, though, we just saw in the paper yesterday that the Ninth Circuit Court upheld the judgment for the Raytheon employees, or retirees, I'm sorry. The judge stated that the retirees and their spouses had a vested right to health care insurance until age of 65. If we had had the money, and again, I want to make sure that your listeners know that those of us that retired didn't have the salaries that Chuck Huckleberry has.
Right.
Mike, what would you say the average retiree income is right now?
In our research, the average state pension that a person receives across the board is $1,100 a month. So, to insure 2 people on the state health care plan, it costs over $1,000 a month. So, in effect, you take your $1,100 pension check and you give it to the insurance company, and you have no money on your pension anymore. That seems to be an acceptable alternative to affordable health insurance. Questions have arisen, well, how do we pay for this? Responses from the county are, go get a job, and then you can, afford to pay your rent and pay your food, pay your utilities. But the health insurance is sort of, that's what your pension's for now.
Wow. What have you done for me lately?
So when I asked, well, gee, are you hiring? They said no. So go find a job. The other thing that I find interesting in all of this, the city of Tucson faced this issue. They chose to honor their retirees and their service and keep them on their insurance. And from what I understand from friends that are retired from the city, their insurance rate, healthcare insurance rate, is a lot lower than the county's. So then you have to ask, well, why does the county hire a consultant, Paul Zuccarelli, to advise them on their health care when they go year to year on a contract with United Healthcare?
What's Zuccarelli making?
Let's go do this. We got to pay some bills before Joe and I have to find new jobs.
Yes.
So we're going to pay some bills. 790-2040 is the phone number.
And both of our parents, my mother worked for the federal court systems, retired from there, and your family as well. So we have these folks in our family that have done their service and have planned their retirement accordingly. And I think, if we talk about reforms, that's one thing, but if there's promises made, that's another. And I think that's the big dialogue.
Yeah, what's the deal? Whatever the deal was, honor the deal.
Right.
So it makes you feel a little better that Chuck Huckleberry pays $850,000 for an 8-person PR department to control the message and get his friends reelected. When you see him screwing the retirees like that, it's pretty nice. 790-2040. We got State Senator Frank Antonori's on the line. We'll get back to him when we come back. Chris and Joe, we're with Susie and Mike, and they're some longtime Pima County employees who are not feeling the love from Chuck, Sharon, Ramon, and Richard. I thought those Democrats were for those working folks, Joe.
What did I miss?
Truth to power, as the mustache says. Wake up, Tucson.
Southern Arizona is waking up to local talk that matters. Wake up Tucson, mornings with Chris and Joe on AM 1030 KVOI, The Voice.
All right, 790-2040 is the phone number. We got Mike and Susie. They're former Pima County employees, over 20 years apiece, that when it got time to retirement time, Sharon, Richard, and Ramon threw them off the county health care, kind of breaking the previous deal. And now they're paying 5 times more than they should for their health care.
Have you contacted the supervisors, gone to the meetings? Have you tried to get your message out there? Or?
Why are you laughing?
Oh, yes, we've gone. What a delight that was.
I think we've used every avenue available to us. I mean, one-on-one communications, emails, letters. We've tried to go to board meetings, and we're sort of relegated to call to the audience, which, as you know, they won't respond to anyone when anyone says a call to the audience.
They're not allowed to, supposedly, legally.
Do they listen attentively, though, at least? Do they sit there and listen?
Sorry, Mike, I've got to make this point. If you've ever gone to a Board of Supervisors meeting, which most can't because they're working, and if you do take time off and go down, they get up and leave while the public's speaking to them. And if they do stay in their chair...
They got a latte machine back there.
They must have something great back there. But if they do stay, then they talk amongst themselves. And then just about the time you think, okay, we're ready to get the show on the road, then they go into closed-door session and leave the public hanging for another... We experienced, 30 minutes, Mike? About 30 minutes waiting on them. So, did we go? Yes, we went. We took signs. Mr. Huckleberry referred to us as early retirees. And
how many years were you there?
26.
So when you go down there to your grievances during Call to the Audience, the Sharon Bronsons, Richard Eliases are basically in the back getting a latte or talking amongst themselves as if you didn't exist.
That's what I experienced.
Well, thanks for your 26 years of service,
yes.
Susie.
Yes.
Good
Thank you.
job.
So I would imagine the current employees are feeling a little concerned. Are you getting contacted? Is there a way that folks can get a hold of you and talk to you about this? Or?
Yeah, we have a website, and we also have an email address. Our website is PimaCountyRetirees.org, and it kind of documents what we've done, what we've been through, the issues. We also advertise training we're trying to provide to retirees and employees about issues such as Social Security, private health insurance, Medicare, investing, because since we've sort of been thrown to the wolves financially by the county, we're trying to help employees and retirees look for alternatives. But anyway, our email is Pima
Retirees?
It's on the little piece of paper there.
Yeah, but you've got the website. It's PimaCountyRetirees.org.
Okay, that's the best way to get a hold of these folks.
That's the best way.
How many infected employees are we talking about here?
There's 700 retirees that were removed from coverage in 2010.
There's about 5,500 folks that still work there, though, that are probably wondering what the future is for them.
So the ones that are currently employed over the age of 55, they're like healthcare indentured servants right now, is what's happening? They're trapped?
Exactly. You're getting a population that should have retired and given our young folks a job. And, it's kind of, you're in that situation as a public service employee. You go ahead and retire to give the younger generation their opportunity, and then what you're told is, well, we deleted you from the insurance. So employees see that. And I've been personally contacted by some of the employees there, knowing that I worked in human resources, to say, what are my options? And the sad fact is, keep working, because if you can't afford this really high insurance, which the retirees are facing another rate increase.
Now,
they have no choice.
I've been on boards where we've had to make the decision to go from a pension to a 401k because of the finances of it.
Sure.
But there's notice and there's conversations. As for the new folks that come in, you set up the dual system, so those folks that have been paying into the system continue to know what they're going to get. So there is some transitions that have to happen around this whole country.
Exactly.
But the way that's handled is how the devil's in the details on
and
these.
grandfathering people in and saying I understand that things can't stay the same forever.
Right.
Sure.
But at least honor and hold your promises to those that you've made and say, work with us. We're trying to find the solutions.
Yep.
Yeah, that's the most difficult part of this. There's many difficult parts of this, but one of the parts is the lack of respect to the people that work there for years and years and years. I mean, we were their managers. We managed their budgets. We ran their programs. And then somehow, once we retire, we've lost all of our sense or all of our intelligence, so they don't want to talk to us anymore. We offered over and over, we continue to offer, let's sit down at the table. Let's look at all the alternatives. There are other alternatives out there in this community. We're not blinded. There's only one game in town. There's only United Healthcare. There's other carriers. Let's look at all the options, and let's come to some kind of a collaborative consensus on what we can do for the retirees now and the people that are retiring in the near future. So that the county can basically, as a manager, you want some turnover in your organization. You want to get new blood in. We want to give people the opportunity to leave the organization in a smooth transition, but also bring in new employees. Right now, the county's basically locked down that back end where people cannot leave till they're 65 years old. There's no room for new blood to come in because all the good positions are taken up by the older employees.
It's amazing. For all the high taxes they collect, all the fees they collect for wastewater, for all the fees that they hit everybody for.
Right.
All right.